Meantime, February, it's almost over, but it is Heart Health Awareness Month, and it's something that really we should be aware of all year round, especially as women, because we tend to brush everything off, and there's some signs you really need to listen to.
All right, so our better buddy Mark Dixon takes us to Hartford Hospital to learn more about heart health, and here's one woman's story.
In 1997, Sally D'Aquila went to her doctor for a routine visit. She had been having intense shoulder pain. Immediately, her doctor performed an EKG.
Said, "You're having a heart attack. I'm taking you over the bridge, and I'm going to get you the best doctor here." And I said, "I think you're losing your mind."
Sally woke up 9 days later. She had undergone a quintuple or five-way bypass surgery. It was her doctor's quick response that stood between her and death.
We sort of talk about time as muscle, and the faster you can get an intervention, the faster you can get to get that heart muscle, its blood supply back.
For the past 2 years, Dr. Donna Polk has been Sally's cardiologist. She's the director of preventive cardiology at Hartford Hospital and says when it comes to defending against heart attacks, prevention is key.
In a lot of cases, people don't get a second chance. Their first presentation of their heart disease is sudden cardiac death.
She says sudden cardiac death can be prevented by keeping an eye out for risk factors that may lead to heart disease.
Some people have a family history, and that gives them a clue that they're at higher risk, but oftentimes people need to know what their blood pressure is, what their cholesterol is, and what the good cholesterol is, what the bad cholesterol is, their blood sugar, whether or not they're diabetic, because it's important. There's a lot of people out there that don't realize they're diabetic or they're pre-diabetic, putting them at much higher risk for heart disease.
The good cholesterol, or HDL, ideally should be 60 or greater. Then the LDL, or bad cholesterol, should be 100 or less. Dr. Polk says that by keeping our cholesterol in check with regular exercise and proper dieting, one may see a regression in the plaque that builds up in the arteries. Yet Polk warns that monitoring these risk factors may be more difficult in women.
Although they will sometimes show up with chest pain and chest pressure, sometimes they'll have jaw pain, shortness of breath, unusual fatigue, different things.
Dr. Polk says Sally's shoulder pain is not typical and made her heart failure difficult to detect, especially since she had no pre-existing conditions. Sally ate a healthy diet and exercised regularly, but she was a chronic smoker.
Smoking causes your blood to be more likely to clot, so it increases the risk for heart attack and for stroke because that makes the blood basically stickier. It also, because of all the impurities and the things that happen with tobacco smoke, accelerates that atherosclerosis, or that hardening of the arteries, so makes the plaque develop more quickly.
Polk says that it is never too late to quit smoking. In fact, quitting can help your good cholesterol rise within even a few days. Within a few years, the risk for heart disease and stroke is down to that of a non-smoker. Just a few weeks after a heart attack or surgery, patients like Sally come to this gym for their next phase of treatment. Using some of the same equipment you see in your local gym, their activity is slowly increased, helping to prevent future heart problems.
And it gives them the confidence to be able to get out there and to get through their illness or their heart attack, and really gets them to be able to live their lives functionally.
Sally says she is thankful to her caregivers at Hartford Hospital for saving her life. She says that her most sincere wish is that all people will be able to experience the level of care that she received.
And our emotions play such a big part in heart disease and how we deal with getting better and where we think the rest of our life should be and what we should do with it. And people literally have another chance.
Good for her. What an amazing story. Quick thinking on her doctor's part. So for more information, you can log on to betterct.com. Make sure you know the signs. And you want to stay with us because the day doctor's here?
How do you get out of the friend zone, Karen?